There's $500 billion in costs borne by health payers just because people don't take their medication or don't do what their doctor's prescribing them. Healthcare in particular, I think there's definitely a need for different perspectives. There's fantastic work being done around developing new breakthrough drugs, new clinical devices, new ways of treating people. But the unfortunate reality is unless we can get people to take those drugs, use the devices properly and stick to the treatment plan, all of that investment and time spent in developing best practice doesn't mean much if the patient doesn't actually go and do those behaviours as prescribed. And so there are other industries who know all about behaviour change, know all about consumer engagement, and they have a lot of practices that can be used to empower healthcare. Perx Health builds motivation programs for people living with chronic disease to help them stick to the daily tasks they should be doing, whether that's medication, attending appointments, or logging clinical results. I have family members who manage chronic disease. I think initially I thought crazy that they don't necessarily do the tasks that the doctor asks them to do every day. Doing a bit of digging, I realised that I wasn't alone, that most people with chronic disease, and in medication in particular, 50% of people who should be taking medication don't take it as prescribed, and so realised the scale of the problem. I have a background in behavioural science, behavioural economics, and that kind of drove me to see what are the other ways that we can motivate people to do the tasks that they should be doing every day. Me and my co-founder are from healthcare, and I think that provides a different lens. Typically when we look at interventions in healthcare, they're really heavily focused on information education. But if you talk to any behavioural scientist or expert in habits, for example BJ Fogg at Stanford, they say their number one rule for engaging and creating habits is to not rely on information education. So we bring a different set of tactics that we've seen work in consumer industries, and we apply those tactics to try and motivate people the same way big consumer companies would. We've been really excited with the progress we've made in Australia. We've signed some really good partnerships there, and we've run a clinical trial which has shown some amazing results. We're looking to find that next market, and the US is obviously a very interesting market in healthcare, and where we think we can make a big difference, help deliver our product to more patients who can use it and benefit from it, as well as work with some of the amazing providers out here to show best practice in care.